Hey, I just wanted to share this interesting case from last week. Patient with Epiphora,
Mhm.
and that means the eye's tearing quite a bit. And what we see here is a very obvious explanation, I think, for the tearing.
Yes. So one aberrant lash, trichiasis, meaning point in the wrong direction, clearly curved towards the eye itself, and thus whenever you blink, it hurts.
Yeah,
There's something in there.
this,
Relatively easy to fix and remove. However, if it comes back, you can sometimes do electrolysis or try other ways to permanently remove it.
what I found interesting is there's other things that could contribute to the eyelid or the eyes actually watering. And there's a technique to do dilation and irrigation to actually squirt some saline, some fluid, into the nasolacrimal drainage system and check if it's open or closed. So this is now that portion where we're seeing just a small cannula going down into the puncta and trying to squirt just a little fluid in there.
And to hear a few things, different preferences, different techniques, different providers do differently. I like using the same technique that I do for punctal plug insertion, where I put a lot of lateral tension on.
Mm,
And then if you look at the cannula, it's thin in the beginning and then it thickens up.
mm.
The reason for that is so you can get it into a very small opening, but the back is almost a seal. So you push it in far enough that it seals, and you can get pretty far into the canaliculus.
When you think about the cannulicular system, you have an opening at the top and bottom, the puncta, which goes to a vertical cannuliculus, then leads to a horizontal, and finally joins at a common cannuliculus.
Um, Whenever you work on the lids, though, you completely change the anatomy. So yes, this technique corrects. A lot of people are taught, I'll go down first and then around a corner. True-ish, depends on what you feel. I think a lot is based on sensation. So you're going to feel it stop, then you turn, and then you advance it as far as you can. And then when you push, I like using a 5 milliliter syringe.
Hmm.
The bigger the volume, the more pressure you can create by a small movement of your hand. I've seen people use a 1 cc and there it's minimal volume. So you can't really flush things through with enough pressure to
Mm.
sometimes clear a blockage. And what I see here is that you noticed as soon as you inject, it regurgitates up on top. So if it regurgitates on the bottom, you either didn't seal it well enough or there's a blockage. If it comes out on the top, then you have a blockage behind the common canaliculus where they both join, so further down.
Hmm. That would be getting back closer to like valve of Rosemuller, I think, is one of those valves that's in there. You got common cannuliculus and valve. Do we care
I'm serious,
about
like
the valve?
I love that you know this, but I mean, it's like it clearly is not working, so there's a blockage.
Something's blocked, but
And
it's not, it's past the common, it's either at or past the common
correct.
cannuliculus.
It can be at the very bottom of the nose, can be anywhere along the nasolacrimal sac or right below. Now, one way that I like to employ, and I've have patients that I now have to do this regularly because she gets recurrent blockages that are basically mucus.
Mm.
So I call this a functional blockage because I can clear it with irrigation. I can flush it through,
Hmm.
but I have to find a way to apply significant amount of pressure to the nasolacrimal sac.
Yeah, so how are you, so you're having to get in deep enough? How are you doing that?
Yes. So it's all about exactly.
Can you block the other
Yes,
opposites? Ah, I
exactly.
like that.
So when it regurgitates, the first thing that I do, I put digital pressure right here. And so it can't
Yes.
go out the top,
Yes.
but you can put a lot of pressure now down towards the nose.
That makes sense. I like that. That makes sense with the anatomy, and also I like that.
And then if it clears, sometimes you can. And it's significant. I've had patients sometimes feels like you can literally almost see them tense up, and suddenly it's like it flushes through. They're like, oh,
And
it's
then they
like a
start to
relief.
taste it and it comes
Yes, it's
down.
yucky. It tastes horrible.
Now,
Yes.
what if that's not enough to relieve the blockage? Then they're needing an actual procedure to pass
Yes.
usually a tube
Yes.
through that system.
Or a dacryocystorenostomie DCR, which creates a bypass from the nasolacrimal sac to the nose directly. You can also put a catheter through the inferior opening and dilate it with a stent. So you can put a stent in there as well.
Got it. Okay. Well, neat case. Thanks for sharing the thoughts with that one. But a lot of things to think about with watering eyes. Usually a unilateral epiphora. We have these sort of diagnostics to go through and think through.